Our daughter Phoebe is 4 years old. She is truly an old soul, remarkably funny, tender-hearted, and has a wild imagination. She can tell a story like no other. Most of them are a mix between some make-believe and true, but she can make a believer out of anyone. She loves the color pink, and she's absolutely in love with animals. Without a doubt, she is by far our best accomplishment.
March 22nd is the day that our lives changed forever. On March 22nd, she essentially received a death sentence. She was diagnosed with a brain tumor. In the end, not really just a brain tumor. This is a brain tumor that has really no effective treatments. The average life expectancy is about 9 months, and there have really been no advancements in treatment for this since the mid-1960s.
Pediatric cancer research has made a lot of progress over the years. In the 1950s, only about 50% of children with cancer survived. Now it's almost to about 80%. 80% is pretty fantastic. However, if your daughter or your son are one of the 20%, it's pretty devastating. That means 1 in 5 children will die from cancer. And it's not just our daughter, it's someone else's son or daughter as well.
I'm Sri Guru Rangan. I'm a pediatric brain tumor doctor at Shands Children's Hospital. I work closely with the researchers at the McKnight Brain Institute, developing immunotherapy protocols, a way of harnessing the body's own immune system to fight these brain tumors. The standard of care of children with brain tumors is radiation, surgery followed by radiation and chemotherapy. Unfortunately, it does not improve the survival of these patients beyond a certain point, and we need new research to improve the lives of these children. Research is in two forms: in the form of a laboratory research that in turn helps us to develop new therapies in the clinic. And both those research, both lab research and clinical research, requires money. And it's very important that we need research funding to develop new therapies for children with brain tumors.
Sarah and I are not naive people. We're actually both doctors. We know a lot about cancer, and we know that there's no silver bullet that's going to cure all cancers. If the survival rates improved from 50% in the 1950s to 80% now, what's to keep us from improving this to 100%? Kids that have cancer don't let cancer define their lives. So why would we let cancer determine the length of their life? The time to change that is really now.